Hi, so I'm Madison, and I go by she, her pronouns.
I'm Megan, and I also go by she, her pronouns.
Okay, Megan, it's so nice to meet you today. So just to start, basically this is just a first referral appointment. It's going to look a lot different from our following appointments. Today I'm just sort of going to be gathering information, and once we move on from this appointment, we can start doing more work that's guided by you and working on things that you want to get into. And then I also just want to talk to you a little bit about confidentiality today. So first of all, everything you say here just stays between us. Nobody else can see that. You're the only one who has any access to any files we have here. There are only 3 instances if for whatever reason I would have to break confidentiality, and those reasons would be if you were going to hurt yourself or somebody else, if you disclose any information about a child being neglected, or like a vulnerable adult, and if there's any child exploitation, like sexually, that you discuss with me. So those are the 3 instances where I would have to break confidentiality. But other than that, everything is just between you and I. So I'm just going to do a little bit of an assessment just to get all your information down. So first, can I just have your date of birth?
October 23rd, 1999.
Okay, and you said your pronouns are she, her. Would you identify as a female?
Yes.
Okay. And what would you say is your race or ethnicity?
White.
Okay. So to start, I'm going to just kind of ask you about why you feel that you're here today.
Yeah.
Were you referred by anybody?
Yeah, I was referred by my school. They actually suggested that I come here.
Okay, awesome. All right, so do you have any goals for our therapy sessions?
I think my goal is to just gain more self-confidence and create a more balanced life and just reduce stress overall.
Excellent. Where would you like to see yourself at the end of our sessions together?
I'd like to see myself being able to get through each day without having anxiety, without being stressed, without worrying about stuff as much, and just being able to give myself coping skills to calm down when needed.
Okay. Was there a time when you realized that you wanted to seek help, or were there kind of steps that you have taken to come here today?
Yeah, there's different steps I've taken. In high school, I saw someone a tiny bit, but not much. And I think just after being in college for a few years, I realized I'm getting towards adulthood, and I just really want to get my life in order before it really starts.
Awesome. Okay. What would you say is the level of intensity of the issues you might be facing?
I would just say average, I guess.
Okay.
I am still able to get through the day, do my schoolwork, go to work, do what I need to do, but there are certain days where I do find it hard to focus, whether it be from anxiety or stress, and just sometimes little things bother me more than I want them to.
Would you feel comfortable sharing what those anxieties might be specifically about?
Yeah, most of my anxiety lately is related to school. Just worrying about getting all my assignments in on time, worrying about balancing work and school. I also have anxiety about my family, just making sure that they're safe and that they're healthy, because I don't live near them.
Yeah.
So that's something else that I think about.
Okay. Can you tell me a little bit about your family? Do you currently live with them?
I only live with them during school breaks.
Okay.
So I live at school most of the time, but I see them maybe once or twice a month, and again on the holidays and school breaks.
Okay.
Yeah.
When you are at home for school breaks and holidays, do you feel safe where you're living?
Yes, I do feel safe.
Okay. So who do you share your living space with?
I share it with my dad, my mom, and my cat.
Lovely. And would you say all of your basic needs are being met?
Yes.
Oh, excellent. And how would you describe your environment while you're home?
When I'm home, it's usually pretty carefree. I can kind of stick to whatever schedule I want, but definitely experience stress with my relationship with my mom. But I think after so many years, I'm just used to it that I kind of just go home and block it out and just spend time with my cat because I love her so much.
That's fabulous. So when you are not living at home, where do you live during the school year?
I live in the dorms.
Okay. And do you feel safe in the dorms?
Yes.
Okay. Who do you share your living space with in your dorm?
I have a roommate.
Okay.
I won't say her name
That's
to
fine.
keep her information private. But we get along really well. We've been roommates for the whole time we've been at Bay Path, and we respect each other's space and don't have any issues.
Excellent. And do you feel that your needs are still being met while you're at school?
I feel they're mostly met, but I do have a lot of issues with the neighbors that we have.
Okay.
But I feel like that's just what comes with college life, so I don't really complain about it. I just put up with it and let it go.
Okay, well, thank you for sharing that. So next we're just going to talk about some family history. So you already described to me a little bit what your family is like. Can you maybe describe just a little bit about each of your family members, your mom and your dad?
Yeah. So both my mom and my dad grew up not far from where I live now. My dad doesn't have any real history of mental health issues, if that's what you're asking about. But he's definitely someone that is a perfectionist.
Yes.
I wouldn't say he's necessarily OCD, but he's very focused on getting the job done, will not sleep until something is done. So very motivated and overworks himself, you could say. My mom, her mental health, I don't know her exact diagnosis, but I would say, at one time she said she had bipolar, so it's kind of up in the air, but she definitely has more lows and highs with her moods, definitely manic situations, so that's what she's dealing with.
Okay. Are there any medical or mental health diagnoses that you know of in your family?
Yeah, definitely. So, like I said, my mom diagnosed with bipolar.
Yes.
My brother was diagnosed with depression and I think anxiety.
Okay.
And my grandfather was diagnosed with OCD, but he denies it because he's 80. And my aunt was diagnosed with depression, and so is my cousin. So it's pretty common.
Okay. Any medical diagnoses?
Yeah, in terms of cancer?
Yeah, it's just any sort of physical diagnosis.
Yeah, my grandmother has cancer. My other grandmother has dementia. And my grandfather has a pacemaker, so he has had heart issues. But in terms of both my parents, they've gotten basic surgeries, but they don't have any major health issues at the moment.
Okay, all right. Is there anybody that you are responsible for taking care of?
I'm responsible for my cat, and I get a little anxious when I'm away from her because I know that she has separation anxiety, which, if you're a cat, why would you not? Why would you not want your humans with you every second of every day? So I feel really bad for her that I'm at school because sometimes both my parents are at work, and then she's alone all day, and she cries in the hallway alone with her stuffed animal, and it just gets me worked up thinking about it. But I try to FaceTime at least 5 times a day so I can see her and say hi.
5 times a day?
Yeah.
Wow. Do you feel that in any way gets in the way of your daily life?
Sometimes I have to do it when I'm rushing from class to class, but I don't really think it's much of an issue because everyone says she's really cute, so it's
wonderful.
worth it.
I bet she's super cute.
Yeah.
Okay, awesome, Megan. So we're going to move on to sort of talking about your social supports. So can you tell me about some of your main social relationships?
Yeah, so I have many categories of social relationships, I guess. I'm really close with my aunt and my cousin, and pretty much most of my main family members. And I have a good group of friends at school. We all support each other when we're going through things. We all have a group chat, so we're all able to communicate with each other frequently. And I have relationships with all of my coworkers at my many jobs that I have. I try to maintain positive relationships with especially my supervisors, so I can get good references for the future and just learn more about my career.
Awesome.
Yeah.
Can you tell me about maybe the people in your main social circle and what that's like?
Yeah. In terms of mental health, or just
how
I interact with them?
Just how you interact, what you might do.
Yeah, so we usually eat a lot of meals together, although sometimes our schedules conflict, but a lot of times we like to watch movies, watch TV shows, get food a lot.
Yes.
And a lot of singing and dancing occur within the dorms. But yeah, most of all, we just like to talk and just hang out and tell each other about our day. So.
Sounds like a fun group.
Yeah.
Where do you feel the most supported, would you say?
I feel it's 50-50. I either feel most supported when I'm here with my core group of friends, or most supported when I'm with my aunt and my cousin, because I grew up being around them a lot. So they know me even better because they've known me since like I was born.
That's awesome.
Yeah.
That's really great.
Yeah.
Would you identify as religious or spiritual?
I would identify as spiritual. I was more religious in the past, but as I've gotten older, I kind of viewed it as a less structured religion and just more like my individual faith of Christianity specifically.
Awesome.
Yeah.
Do you have any religious or spiritual practices that are very important to you?
I don't necessarily, I mean, I celebrate Christian holidays, but I don't necessarily pray every day at a certain time, but I do pray, like, basically, like, within my mind, just to myself and God, but I don't really, like, sit down and pray out loud every day, like, structured.
Okay.
Yeah.
Do you have any significant aspects of your culture that you maybe celebrate or want to discuss?
I just celebrate Christmas and Thanksgiving the most, and definitely Easter, but other than that, my family always likes to celebrate holidays and thinks that they're really important.
Awesome.
So, yeah.
Great. So we're just going to talk a little bit about education. So what's the highest level of education that you've completed in school?
I've completed my high school degree, and I'm currently obtaining my bachelor's degree.
Awesome. So how is school for you, would you say?
I'd say it's pretty good. When I first came to college, I was like, oh, this is so easy. Like, it was way easier than high school, but it's definitely gotten harder as I've added more things to my plate, combining it with work. But I think it's really good, and I'm really happy with where I am.
Awesome.
Yeah.
What are you studying?
I'm studying professional writing. I used to study psychology, but I switched about a year ago, and I really think it was a good decision for me. Yeah.
Yeah. Where do you see yourself taking this degree?
I'm in the middle of thinking about that, and there's so many options with writing. Everyone just assumes that if you're studying writing, you're going to be an author, but I'm probably more going to go like the professor route or the teacher route, because I really like working with students. I'm a peer mentor as well, so I want to keep that in my career.
Excellent.
Yeah.
Okay. Great. So now we're just going to talk about employment and meaningful activities such as like hobbies and what you do for fun. So to start off, do you have a job currently?
Yes, I have 2 jobs currently. I kind of had 3. I guess I have 2. Yeah. Yeah.
Busy girl. Can you tell me about them?
So one job is a work study position that this is my 3rd year having it at Bay Path. And it's with Strategic Alliances. We do many events at the Bay Path campus, like Kaleidoscope events. And we do the Women's Leadership Conference, which is March 27th, 2020, for anyone who wants to come. A little promo in there. So I love that event just because you get to meet so many people. I love helping research the speakers, and I get to write things about the speakers. I get to like help pick the music. So I find the job like really rewarding and exciting. And then my other job is being a peer mentor. So I helped with orientation week, which is like really busy, really intense, but it helps the first years kind of become a little less stressed once classes begin. And I'm also, as a peer mentor, you're in the class with them 2 days a week in their Well 100 class, and I kind of just help the teacher get important messages across and show them my past assignments and and like give them my advice based off of my experience in college so far.
Awesome.
Yeah.
Great. Those sound like really awesome jobs for you to have. So what would you say you would do outside of work for fun?
For fun, outside of work, I definitely like to hang out with my friends, but lately I've definitely been more into reading. I feel like once you start college, you kind of forget about reading for pleasure, but I think it's so important to have that downtime. And I also like to watch Netflix, but yeah, just like spending time outside, listening to music, those types of things.
Awesome.
Yeah.
So what would you say like your day-to-day life looks like?
My day-to-day life, well, I have early classes this semester, so go to class at like 8 a.m. Monday through Thursday. Then I have like sometimes tiny breaks, then I have lunch, and then I'll have work for a few hours, and sometimes an afternoon class. And then there's occasionally an event that I have to work at nighttime, but usually if I don't have that, I would just go to my room after dinner, take a little break, and then do some homework. Yeah.
Great. Is there anything that you wish you could do or add to that routine that you aren't able to do right now?
Yeah, I definitely wish that, like, I mean, I do have structure, like, based off of, like, my work and my classes, but I wish that, like, after dinner, I, like, had more of a structured situation where I'd be like, okay, I'm going to do all of these assignments on this day. I think I always like I'm too hard on myself. I want to get ahead in every class and like make sure I have everything done. And sometimes like the pressure of trying to do everything ahead of time is a little too much. So just trying to make that better.
Okay. Great, Meg. So now we're going to move on to just talking about like your income and financial supports. So what is the main source of your income right now?
The main source is my work study position because it's about 10 hours a week.
Okay.
So.
And are you able to meet most of your needs with that income?
Yeah, I'm able to meet pretty much like my personal needs, like paying for gas, like a food occasionally, and clothing, and my cell phone bill. Those are the main things that I pay for, but my parents do support me as they pay for my car insurance, and if there's any like, you know, big issues, like if my car breaks down, like if I need to replace technology that I have or something, they would help me with that a little bit.
Awesome. So you would say that you do receive financial support from your parents?
Yeah.
Okay. And do you receive any sort of like government help or services?
I do only for academics, not for anything else.
Great. Have you ever served in our military, or do you have a family member who has?
My grandfather did. He's a veteran.
Okay.
But,
awesome.
yeah.
So we're going to talk about some like substance use and just some general questions about that. So do you have any history of substance abuse, or do you have a family member who might?
Yes, I do have family members with history of it.
Okay.
But not myself.
Okay. Can you share what substances that they might have used?
Yeah. So my family member, their main substance that they use is alcohol.
Okay.
It's been an ongoing struggle for them, probably for about like maybe 20 years now, back and forth. So they battle with it. There's years where like things are pretty much fine, but then there'll be years where it's more difficult for a few months or for a few weeks. So they kind of go with that back and forth, and they're in and out of counseling, but not consistently. So yeah, it's just kind of.
But no history of substance abuse of you yourself?
No.
Okay. Do you have any addictive behaviors outside of the realm of substance?
No.
Okay. So now we're just going to talk about some like mental health and treatment history. So have you had any past treatment? I know you talked about counselors in high school and such.
Yeah, I pretty much just went to a couple counselors in high school, and that's it, because I was like, I can do it on my own. Like, I can be fine. I don't really need help from anybody else to get through in life. But now I'm like, oh, maybe I should. So,
okay.
Yeah.
And all this treatment was voluntary?
Yeah.
Okay. And would you feel that it was productive in the past?
No, I don't think it was productive, because it was basically like a school counselor, and I just went in there and would complain about my life as a teenager. And things have changed for me so much since then, so I feel like I definitely should have gone back earlier than I have.
Yeah.
And they weren't really a licensed counselor, they were more like a social worker, so it wasn't productive because I wasn't open to it being productive. And I wasn't willing to develop more.
Okay. So you feel like you might be in like a better place now?
Yeah, now I'm like, I want to get better and like improve, but I think definitely in high school I didn't. I thought I wanted to, but I really just wanted to fix the people around me, which I guess I can't do, but
and are you on any medications currently?
No.
Okay. So now we're just talking about physical health. Do you get annual physical checkups?
Yes, I do.
Excellent. Do you have any past physical health issues?
Yeah, the only issues I've had have been ovarian cysts and ovulation pains. But that's basically it. Also had to get stitches on my lips a couple times from falling and passing out, but those were accidents. So that was it, yeah.
Any chronic pain as a result of any of these issues?
No.
Okay. Awesome. So now we're just going to move into some more things in your history. Is there anything in your past that you want to focus on now, or that you feel that I should know about during your sessions?
Yeah, I feel like we should probably focus on that my brother passed away last year from suicide. So I basically thought, like I said, that I could just do things on my own and not go to a counselor, because I kind of wanted to help all my family members through it, because I felt like they needed me more than I needed help. But now I'm like, okay, I need to help myself. So just like dealing with grieving is probably what I should focus on the most.
Okay, thank you for sharing that. So do you know if you have any history of trauma before this incident, or do you feel that this is the main event that has affected you?
Yeah, that's like the main event that's affected me. I did not experience any abuse in my childhood, or anything like that. So that's just the main event that's changed my life recently.
Okay.
Yeah.
So now we're going to try to end with some strengths and resiliencies that you might have. So I'm going to start by asking you, what's your favorite quality about yourself?
I think my favorite quality about myself is, I don't always do it with myself, but whenever someone presents me with a negative situation or a negative comment, I always try to spin it around and make it positive. I try to listen to what they're saying first and agree that it's not fair, whatever's happening, but I always try to be positive and just have a smile on my face every day and just try to like have a good day.
Excellent.
Yeah.
That's an awesome quality. And it sounds like that you have long-term and stable living situations, which is a really awesome thing. And you get along well with your roommate and for the most part with your parents.
Yeah. Most of the time.
Yeah, and it sounds like you have a really rewarding job.
I do.
That's really awesome. And you seem very happy with your friends and with all your social circles.
Yes.
Excellent. Well, thank you so much for meeting with me today, Megan.
Thank you.
I look forward to our future sessions.
Yes. I'll see you soon.
Yes. Thanks for watching.